some of the symptoms if you have a heart attack? And what would you do if you or someone around you has a heart attack?
It's again, my take on this is, I believe I am susceptible to heart attack. That's the first acknowledgement that needs to happen. Most people think, heart attack will happen to a stranger or a ghost, not to me or my dear ones. That's the notion that needs to go out.
Right.
And then look at those people who are vulnerable. Who are vulnerable to heart attack? Those who are obese, those who smoke, those who have hypertension, diabetes, high cholesterol, and those who are apparently healthy but whose family there's a history of heart disease at a younger age.
Yeah.
These are the people who are most vulnerable. Most important, smoking. That's number one killer. Be careful. Once you know these susceptible people, you need to educate them and make them believe that they are vulnerable to watch out for those symptoms. Fantastic question. What are the symptoms of heart attack? Heart attack tends to have one common symptom, that is discomfort.
Right.
It's not always pain. A discomfort usually in the center part of the chest or on both the part of the chest, anywhere between umbilicus to jaw. It can be perceived as constricting pain, heaviness, tightness, or stabbing pain, or burning. Many patients think it's a gastric or acidity and they take over-the-counter medicine and they don't even reach the hospital. We lose them even before that. So the symptom is just a discomfort. It could be heaviness, tightness, squeezing, burning or stabbing, any of that, which is usually in the center of the chest and on both sides and on the inner part of the arm and to the shoulders and to the jaw. All these are symptoms of heart discomfort.
Right.
Many others may not feel this discomfort or pain. They may just become severely breathless, or they could feel giddy and fall, and some of them may become unconscious.
Right.
Because heart either stops or starts beating so fast. Instead of beating 100 to 120 times, it starts beating at 400 when it is just quivering and unable to send the blood up to the brain. Unless you shock them, they don't survive.
Very true. So they absolutely have to get to the hospital when they experience these symptoms. There's nothing you can do at home, is there?
This is a very important area again where we are not educated. We should all learn basic life support system.
True.
It doesn't matter on whom you may have to perform it, but I think all of us need to train ourselves. Our hospital at Apollo, our emergency chief teaches it for free to all the police people, the school teachers, the school children, the employees at software industry. We offer them this free training to save a life. So to say that if somebody becomes unconscious or has a heart attack, he is destined to die unless a doctor, an angel comes down to him. No, I think we have a responsibility. All of us need to train ourselves on the basic life skill support. That's either, compression of the chest and breathing. Second, most important thing is call an ambulance. Never take a patient by your own vehicle, because most people die in their own vehicle. When an ambulance arrives, there's a qualified person inside with all the medication and the equipment to save the life from the time they have recognized the patient in the home or office and he reaches the hospital. So very important to know the value of ambulance. Always stick the ambulance numbers like 108, 1066 so that any emergency, call an ambulance.
True. Is there any medications that we can give if they're conscious patients who are on their way, en route, waiting for an ambulance? Is there anything that we can do?
Fantastic. I think please have these emergency room numbers of the hospitals. If you find somebody, seemingly suffering from a heart attack, please call one of the doctors if you know them, or the emergency room. Tell them that we have one of a colleague or friend or a family who is complaining of these symptoms. We suspect it's heart attack. What do you want me to do? The basic thing is you could have certain medicines like an aspirin,
Right.
which should be and must be kept in most homes, and it could be dissolved in a small amount of water and ask them to swallow. Apart from that, please be on the line on the emergency physician or the doctor that you know till the ambulance arrives so that another doctor can take over. So it's very, very important.